Imagine you're in a high-stakes situation. A patient's heartbeat is irregular, fast, and chaotic. What's going on? Could it be ventricular fibrillation? If so, how do you manage it? Today let's take a deep dive into the world of ventricular fibrillation, a life-threatening arrhythmia that demands immediate attention. We'll explore its pathophysiology and arm you with the latest recommendations for its management from the American Heart Association's 2020 guidelines. Stay with us as we untangle the mystery of ventricular fibrillation and equip you with the knowledge to handle such scenarios. Ventricular fibrillation, or VF, is a serious cardiac condition that can be life-threatening. But what exactly happens during VF? At its core, VF is an abnormal heart rhythm, or arrhythmia, that originates in the heart's lower chambers, the ventricles. This rhythm disturbance is characterized by rapid, irregular, and chaotic electrical impulses. Instead of synchronously contracting to pump blood out to the body, the ventricles quiver or fibrillate. This results in an ineffective heartbeat and a dramatic drop in blood flow to vital organs, including the brain. The onset of VF can be abrupt and without warning, often leading to sudden cardiac arrest if not promptly treated. It's a dire situation where every second counts. The lack of blood flow can quickly lead to loss of consciousness and, if left untreated, can result in irreversible brain damage or even death within minutes. It's a race against time, underscoring the critical need for immediate intervention. But what causes VF in the first place? Several factors can trigger VF, including severe heart disease, heart attack, or certain inherited disorders that affect the heart's electrical system. Additionally, certain drugs, imbalances of electrolytes in the blood, or severe physical stress can precipitate VF. It's important to note that VF is an electrical problem, not a blockage issue like a heart attack. However, a heart attack can lead to VF if the heart's electrical system is disrupted. In VF, the heart's electrical signals become chaotic, leading to a disorganized rhythm that prevents the heart from pumping blood effectively. Now you might be wondering, what are the signs of VF? Well, because it happens so suddenly, there may be no warning signs at all. But in some cases, people may experience chest pain, rapid heartbeat, dizziness, or shortness of breath just before the onset of VF. Knowing how VF affects the heart underscores the importance of rapid and effective response. In the next section, we'll delve into the latest updates and recommendations for managing VF, giving you the tools you need to respond effectively when every second counts. The American Heart Association's 2020 guidelines offer updated recommendations for managing VF. So, what's new? Let's delve into the key changes that have been introduced. The initial assessment protocols have seen significant improvements. Instead of a linear approach, the guidelines now advocate for a more dynamic and simultaneous evaluation. This involves integrating the initial patient assessment with the immediate initiation of high-quality CPR, aiming for an uninterrupted, seamless transition. The advancement in defibrillation strategies is another major highlight. The guidelines now emphasize the importance of minimizing pre-shock and post-shock pauses, reducing unnecessary interruptions to chest compressions. This is critical as every second counts when dealing with VF, and any delay can significantly impact the patient's outcome. The 2020 guidelines also introduced the concept of dual sequential defibrillation for cases of refractory VF. This involves delivering 2 shocks instead of 1, potentially increasing the chances of terminating the VF rhythm. However, it's important to note that this is still an area of ongoing research and regular updates are expected. Moreover, the use of waveform capnography has been underscored, not just for confirming the placement of an advanced airway, but also for monitoring the quality of CPR and making necessary adjustments in real time. In essence, these updates are designed to optimize the VF management process, making it more efficient, effective, and most importantly, tailored to the patient's needs. Keeping abreast of these updates ensures you're equipped with the latest evidence-based practices. Recognizing VF promptly is crucial for successful outcomes, but how can we achieve this? Let's delve into the details. Maintaining a high index of suspicion is the first step. When faced with a patient exhibiting signs of cardiac distress, always consider ventricular fibrillation as a possible culprit. This mindset will ensure you're prepared for swift intervention. Next, utilize advanced monitoring technologies. Modern electrocardiograms provide real-time insights into the heart's rhythm and electrical activity. By interpreting these readings accurately, you can identify VF early, even before more severe symptoms manifest. Now let's talk about intervention. Time is of the essence in VF scenarios. As soon as VF is identified, begin high-quality CPR and prepare for defibrillation. Simultaneously, call for help. The more hands on deck, the better. Let's walk through a simulated scenario. Imagine a patient presenting with sudden loss of consciousness, absent pulse, and irregular heart rhythm on EKG. You suspect VF. What do? Start CPR immediately. Ensure the defibrillator is charging, and administer the shock as soon as possible. Remember, every second counts. In another case, a patient presents with recurring VF despite initial defibrillation. This calls for a different approach. Consider administering anti-arrhythmic medications like amiodarone or lidocaine, as recommended by the AHA guidelines. In conclusion, successful management of VF hinges on prompt recognition and swift intervention. A high index of suspicion, effective use of monitoring technologies, and timely initiation of CPR and defibrillation are key. Prompt recognition and swift action can mean the difference between life and death. We've covered a lot of ground today. Let's quickly recap the key takeaways. Our journey began with understanding the pathophysiology of ventricular fibrillation, a life-threatening arrhythmia that disrupts the heart's normal function. We emphasized the urgency of prompt recognition and intervention, and how advanced monitoring technologies can aid this process. We then moved on to the cornerstone of VF management, high-quality CPR. Remember the importance of proper compression depth, rate, recoil, and minimizing interruptions. We also highlighted the role of advanced airway management techniques and waveform capnography in optimizing CPR quality. Defibrillation, as we discussed, remains the primary intervention for restoring normal cardiac rhythm in VF. The nuances of defibrillation energy selection, electrode placement, and timing of shocks were explored. We also delved into the potential role of dual sequential defibrillation in refractory VF cases. We reviewed the crucial role of anti-arrhythmic medications like amiodarone, lidocaine, and epinephrine in VF management, as recommended by the AHA's 2020 guidelines. And lastly, we looked at advanced interventions like ECMO and therapeutic hypothermia for refractory or recurrent VF, along with the importance of post-resuscitative care and neurological assessment. Staying abreast with the latest guidelines and recommendations is pivotal to improving patient outcomes. Remember, your knowledge and quick thinking can save lives. If you found this video helpful, do like it and subscribe to our channel for more such informative content. Having touched on defibrillation earlier, let's delve deeper into the mechanics of it. When it comes to defibrillation, the type of defibrillator and the energy selection are crucial. First, let's understand the two types of defibrillators, monophasic and biphasic. Monophasic defibrillators, as the name suggests, deliver a one-directional charge. They typically require higher energy levels, often starting at 360 joules. On the other hand, biphasic defibrillators deliver a bidirectional charge. They are more efficient, thus requiring lower energy levels. Usually, a starting energy of 120 to 200 joules is recommended. The American Heart Association provides guidelines on the recommended joule selections for both types of defibrillators. For monophasic defibrillators, the AHA recommends a single shock of 360 joules. For biphasic defibrillators, an initial shock of 120 to 200 joules is recommended, although some may be set to the maximum joules. Understanding the differences between monophasic and biphasic defibrillators and their appropriate joule selections can greatly impact patient outcomes. It's not just about using the defibrillator, it's also about using it correctly. In our next scene, we will provide a step-by-step guide on how to use a defibrillator correctly, so stay tuned.